Ladies and gentlemen, welcome to our latest vlog with the COO of EchoIQ. The ticker is EIQ. We're super excited about this particular company. It uses AI technology to monitor heart conditions instantly. Keep an eye out on this one. They came out pretty impressive in quarterly. That's why we've got him back on. Phil, how are you?
John, I'm great. Thanks for having me. Great to be here.
Absolute pleasure. Now, I want to start off with the exciting new pilot program that you have. Tell us a bit more about it. It's a potential game changer for the company.
Yeah, absolutely. Look, as you say, we are using artificial intelligence to help improve detection and identification of actually a range of heart diseases. So we are particularly thrilled to be entering into a pilot agreement, a commercial pilot, with a group called Advara Heart Care. Advara Heart Care was previously Genesis. They will be well known, I think, to a number of your viewers. They are the leading cardiology provider in Australia. We're entering into a commercial pilot where really they will be using our technology to take a look at their records that they've got in Western Australia. And I think based on the strength of that, we are cautiously optimistic of a wider rollout. So definitely exciting, the nation's leading cardiology provider.
That's great news. Now, you also introduced EchoSolve. Tell us a bit more about that.
Yeah, so EchoSolve really is the name of our solution, this AI-backed tool. It's a decision support tool. It's software. It gets used by healthcare professionals. And really, when we're looking at diagnosis of various forms of heart disease, and specifically we're talking structural heart disease, and these include things like valve diseases, mitral stenosis, mitral regurgitation, aortic stenosis, they're actually quite tricky to diagnose accurately. For most of them, the first point of diagnosis is an echocardiogram. That's an ultrasound or an image of the heart captured using sound waves. And typically, healthcare professionals are reviewing for multiple conditions all at the same time. They are going through an enormous amount of data, and it's not always easy to pinpoint or identify exactly what condition or what disease they are dealing with. EchoSolve is designed to really help healthcare professionals get more accurate, more often in their diagnosis. And the big news for us, I think, is that we've just really gone from a single solution, aortic stenosis, and we've announced a much broader range of conditions that EchoSolve will be addressing. So early in the new year, our customers can expect to see a wider range of conditions being addressed.
So right now, how many different types of heart conditions out there for those who don't know, and the possibility of EIQ monitoring all of those potential conditions?
Yeah, look, John, there are myriad heart conditions. So we often hear about artery disease or clogging of the arteries. That's outside our space currently. What we are looking at is really when you get to the heart muscle itself. So it involves things like heart failure, aortic stenosis, mitral regurgitation. It involves things like diastolic dysfunction. There is a wide range of conditions, and really we're looking at between 6 and 8 right now. And I think the key thing is that, cardiovascular disease is the world's biggest killer. It kills 3 in 10 people. These are conditions that are prevalent. They're increasing in prevalence as people are living longer. But the key to these is that they're also increasingly treatable. Treatment comes in 2 forms. It can typically be a mechanical intervention, so it could be a replacement valve that is used. And for certain conditions, such as heart failure, we see pharmaceutical and drug interventions that are effective at reducing the impact of that.
So I have to admit, I got excited about EIQ when you signed up the deal with the private hospital up in Gold Coast, because I saw the pathway to commercialization and profitability. Can you speak about that for our viewers?
Yeah, absolutely. So you're right. We've announced our first 2 customers in Australia. And, typically in this space, the lead times they're long. And we see in healthcare, even in software applications, lead times of anywhere from 18 to 24 months. By the time we go through value and analysis committees, ethical review, IT compliance, governance, etc. So they can be quite lengthy processes. We were very pleased to announce our first 2 commercial agreements in Australia in far shorter timeframes than that. We are a business that is making progress rapidly. We feel confident, and we've announced in our quarterly that was issued earlier this week that we expect in the current quarter to announce our first contracts in the United States. We've been really sort of pursuing the market strongly for about 12 months now. So we're about 12 months from initial presentations. So I think we're ahead of those typical industry timeframes, and we're feeling positive about that.
Now, you just mentioned the US market, which is the biggest. Tell us a bit more about that and how you guys are going to enter and break into it.
Yeah, so I think there's a few things that I'd say about that. It's a big market. It's the biggest cardiology market in the world, but it is a market that is rapidly seeing an extremely important role for AI-backed solutions in cardiology. We have got 3 people on the ground in the US. They are members of the EchoIQ team. They are highly experienced. They are well advanced in discussions with a large number of significant hospital groups in the United States. We've got a number of those conversations at fairly advanced stages of development. We've also got 2 quite important things happening in the US that are complementary to that direct approach. So one is a partnership with a leading distributor, Castling, and another one is that we are really pursuing integrations with PACS and reporting providers. So PACS is a term used in the sector, picture archiving and communication systems. It's really the reporting system that healthcare professionals use to capture the images, the measurements, the reporting. It's their workspace, if you like, in this field. And so rather than really looking at a bespoke integration anytime someone was interested or considering EchoSolve for their practice, we have integrated with a number of those reporting providers. So one of them is one of the large providers in the United States. It's a product called StudyCast, and that was announced really a couple of months ago. We've added 2 more since then, and we'd expect to announce more of those as well in the weeks and months ahead. So this gives people in the US, and in fact anywhere, a really quick way of getting EchoSolve integrated into their practice without some customized start at the beginning integration.
And lastly, what do shareholders have to look forward to over the next 6 to 12 months?
Yeah. Look, I think they can look forward to quite a number of things. So first of all, there's the introduction of these extended EchoSolve solutions. Secondly, I think they can look forward to good news commercially, a number of those business development discussions really coming to fruition. We can see benefits, I think, from a number of those integration partnerships. One of the things that people are interested in is our FDA journey. So one of the particular solutions that we look at is really an AI-backed phenotype around aortic stenosis. So this is really, if you like, the birthplace of EchoIQ, and it's really about looking for and identifying patients at risk of aortic stenosis who may not meet current diagnostic guidelines. And this is interesting because this gives healthcare professionals a real view on who they should be taking a really good second look at. We know that left untreated, a number of these conditions can be fatal rapidly. So any tool that we can give healthcare professionals that help them really prioritize, who needs looking at right now, who do they need to bring back tomorrow, that's critical. And so we're quite advanced on that FDA journey. We are just completing a reader study in the US around that and in support of that final application. So I think investors can really expect us to have submitted our final FDA application really in the next couple of months or so. And then we see fairly well-structured timeframes, 90 days typically for a resolution on that from the FDA. So that's certainly something I think investors can look forward to early in 2024.
So all the viewers out there, keep an eye out on EchoIQ. We're excited. We see the pathway to commercialization. At the very least, it might even save your life one day. Phil, thank you for your time. I know you're a busy man and we really appreciate it.
Thanks. Great to chat again. Take care, John.
See you next. Bye.